The CDC says the BA.5 subvariant of Omicron is now the nation's most dominant strain of COVID. Tonight, our National Verify team looks into whether or not it's more likely than past subvariants to reinfect people who have already had the virus.
The Centers for Disease Control and Prevention estimates that 4 in 5 people who are positive with COVID-19 have Omicron subvariant BA.5. The number of BA.5 cases has increased since early June. Now, some people on social media are sharing their experiences getting reinfected with BA.5 soon after recovering from COVID-19. So let's verify. Is the BA.5 subvariant of COVID-19 more likely than other subvariants to reinfect people? Our sources are the CDC, the World Health Organization, Beth Israel Deaconess Medical Center, and Dr. Anthony Fauci, Chief Medical Advisor to President Joe Biden. When a person recovers from COVID-19, they have some natural immunity from reinfection. The WHO estimates people who recovered prior to the spread of Omicron had 90% protection from reinfection. But those odds have changed with Omicron and its subvariants. And people who had a prior variant now have just 40% protection from reinfection against BA.5.
If you were infected with BA.1, you really don't have a lot of good protection against BA.4/5.
Similarly, researchers at Beth Israel Deaconess Medical Center studied people who had immunity from either a prior infection or a vaccine. They found antibody responses to BA.4 or BA.5 were about 3 times lower than Omicron variants BA.1 or BA.2. So, yes, the BA.5 subvariant of COVID-19 is more likely than other subvariants to reinfect people. Still, health officials say vaccines offer a high level of protection against serious illness and death. With your Verify, I'm Brandon Lewis.